Pectoral, intrinsic shoulder muscles. Pectoral region. Subclavius. From first rib to the inferior surface of the clavicle. Serratus anterior. Boxer's muscle that originated from the rib 1 to 8 and inserts into the anteromedial border of the scapula. Pectoralis minor. From rib 3, 4, 5 to the coracoid process of the scapula. Pectoralis major. Huge muscle that has 2 heads. Clavicular and sternocostal heads. Inserted into the lateral lip of the intertubercular sulcus. Intrinsic shoulder. Deltoid. Is a huge triangular-shaped muscle that has 3 heads. The anterior, middle, posterior, and it flex, abduct, extend respectively. Teres major. Commonly misunderstood as a rotator cuff, but it isn't. Extrinsic shoulder muscles. Firstly, we will cover 2 broad superficial muscles. Latissimus dorsi. This is a swimmer's muscle that originate from broad area, as you can see on this image. It inserts into the floor of the intertubercular sulcus. Trapezius. Triangular-shaped muscle, and it has 3 parts. Descending transverse ascending fibers. Insertion point is like the deltoid, but more on superior surface. Deeply we have 3 muscles. Levator scapulae. It describes the function that elevate the scapula from the neck. Rhomboid minor. Small rhombus-shaped muscle that inserts into the medial border of the scapula. Rhomboid major. Is older brother of the rhomboid minor, which is broader and inferior to. Take a quiz and leave the answer on the comment. Rotator cuff muscles. 3 posterior and 1 anterior muscles are building a cuff-like structure, as you can see on this image. So, we call it rotator cuff muscles. It is important to understand the logic of the nomenclature. We can see the spine of the scapula. Superior means above others, and this muscle is above the spine. So, we call it as a supraspinatus. This one is inferior to the spine. Now you can guess that it shall be called infraspinatus. Teres means rounded. We have 2 rounded muscles here, and this is small one, so it is teres minor. Many of students include teres major, but it isn't. Last one in on the anterior side. It is under the shoulder blade. Latin word under is sub, and shoulder blade are scapula. So, we name it as subscapularis. Take the quiz and leave the answer on the comment. Anterior compartment of the arm. Firstly, I would like to emphasize the importance of understanding the logic of the nomenclature. Brachium means arm, so all these muscles will be going to include brachii on its name. Coracoid process to the arm, which is brachii. So, it names as coracobrachialis. Brachialis originate from the brachium and inserts into the ulnar tuberosity. The famous biceps brachii. Bi means 2 and ceps means heads, which means 2-headed muscles of the arm. So we named it as the biceps brachii. Long head originate from the supraglenoid tubercle and goes laterally. Short head originate from the coracoid process. 2 heads will blend together and inserts into the radial tuberosity and bicipital aponeurosis. Take a quiz and leave your answer on the comment. Thank you. Posterior compartment of the arm. Today is very simple that all we must cover is only 1 muscle. Let's think about the meaning of the triceps brachii. Tri means 3, ceps means heads, and brachii means the arm. 3-headed muscles of the arm. To define 3 heads, we must know the radial groove where the radial nerve passes through. Medial head originate from inferomedial to the radial groove. Lateral head originate from superolateral to the radial groove. Long head originate from infraglenoid tubercle. Then, all 3 heads blend together and inserts into the olecranon process of the ulna. Take a quiz and leave your answer on the comment. Thank you. Anterior forearm. We have superficial, intermediate, and deep layers. 4 muscles of the superficial layer. Everyone may have experienced to get crush onto someone and pick up the flower, taking out the leaf and say he loves me not. Likewise, I will pass, fail, pass, fail. Pass for pronator teres, which means round-shaped muscle that makes lying face downward. Fail for flexor carpi radialis. Pass for palmaris longus. Fail for flexor carpi ulnaris. Flexor digitorum superficialis does belong to the intermediate group, and it inserts into the middle phalanges. that can't control distal interphalangeal joint. Deeply, we have flexor digitorum profundus, and it can control distal interphalangeal joint. Flexor pollicis longus bend the thumb. Lastly, we have square-shaped pronator quadratus. Posterior compartment of the arm, part point 1. There are many muscles to cover, but rest assured that there is a trick. We name the muscle by its function, location, and description. From around the lateral epicondyle, we can find 4 extensors. So, all of them start with the extensor and then you must see where it goes. We can observe that 3 goes to the wrist, which are named as carpi, and 1 to the fingers, which is digitorum. So, these are going to be named extensor carpi and extensor digitorum respectively. Since we have 3 extensor carpi, we have to figure out the way to differentiate. So, we give more information that if it is on the radial side or the ulnar side, 1 goes to the ulnar side is called extensor carpi ulnaris. However, on the radial side, there are 2 extensor carpi radialis, so we must put more description. Let's take the length that will make longus and brevis. Now we can differentiate them as an extensor carpi radialis longus and extensor carpi radialis brevis. Obviously, long one shall be more superficial that shorter one can't cover. The longer one, longus inserts into the second metacarpal base and the brevis on the third. Luckily, we have only one structure that goes to the fingers, so it is simply called extensor digitorum. Posterior forearm muscles. Part point 2. Supinator named after its function. And coneus that inserts into the olecranon. Brachioradialis is acting like a spy that belongs to the posterior compartment, so innervated by the radial nerve, but the function is flexion of forearm at the elbow joint. On the posterior side, we have individual finger muscles that make Spider-Man hand gesture. Extensor indicis that extends the index finger. Extensor digiti minimi that extends the pinky. Anatomical snuffbox, aka radial fossa, is triangular space around the thumb. Since the muscles making this boundary are extensor pollicis, extending the thumb will make it more visible. Let's start from the borders. This is a pronated position, so orientate yourself properly. Ulnar is always medial. Medial border, extensor pollicis longus tendon. Lateral border, abductor pollicis longus and extensor pollicis brevis tendon. Proximal border, styloid process of the radius. The floor is built of scaphoid and trapezium, then it is covered with the skin. Contents, radial artery that you can easily feel the radial pulse. Radial veins, dorsal venous network that will contribute to the cephalic vein. Superficial branch of the radial nerve. If there is a history of trauma and pain around the anatomical snuffbox, you should rule out the scaphoid fracture that can develop to the avascular necrosis. This is a quick revision for the posterior compartment of the forearm muscles. Read along with me that repetition is the key to the learning process. Let's do this. Supinator, anconeus, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, extensor digiti minimi, extensor carpi ulnaris, extensor digitorum, radial artery, vein, nerve, more specifically, superficial branch of the radial nerve. Intrinsic hand muscles. Be aware that extrinsic hand muscles are located on the forearm. Thenar and hypothenar group are a mirror image. From the side to center, they are abductor, flexor respectively. Then, opponents deeply located. We already covered abductor and flexor pollicis longus. So, on thenar group, we have abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. Like that, on the hypothenar, we have abductor digiti minimi, flexor digiti minimi brevis, and opponens digiti minimi. If you look closely on the tendon of flexor digitorum profundus, you can find worm-like lumbricals. Deep to that, adductor pollicis can be found that has transverse and oblique heads. In between metacarpals, we can see the palmar interossei and the dorsal interossei.